Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Okay, well, we're having a wonderful day here. You know, it's funny. You know, Ina, I'm glad you're here.
Good morning.
Are you affected by this daylight savings?
Very much.
I mean, I am too, because it's so dark in the morning and all of a sudden it's 8 o'clock.
People oversleep because it's so dark in the morning.
Yeah, I mean, I don't know even how. Now, in Russia, do you have a thing called daylight savings? Do they change?
We used to have it, but about 6 or 7 years ago, the government decided not to do it ever again. So we don't do this time change saving thing.
I guess they thought they wanted to do it so people would have more time at night to be out. But I don't like it. I want it just to be the same all the time.
No, you have to be the same because it's very stressful even for the young people like I am. Even for my son. My son told me that, Mom, I don't like this time changing. I'm so sleepy. You know, and it's
dark
like
and he has to get ready to go to school.
Right. And it's for every age, and especially for the elderly people, you know, that very, very, very affects them.
Yeah, I would think so, because when they get up, you know, and it's dark, it's so early, it's depressing. Don't you think?
Mm-hmm.
Yeah, because I wait, like we're sitting here in the studio at WSBR, and this is, you know, Ina is the major Duomo at the A&AG Medical with Dr. Mencia. We're talking about, Dr. Mencia, we are talking about daylight savings, and that it's dark and it's depressing because an older adult gets up in the morning.
And elderly people do wake up early all the time.
That's why the show is good. But then it's still dark and it's sad. And they want it to be light, because we're sitting here with this beautiful window, and it changes everything as soon as the sun rises. And we see it. So, I don't know, Dr. Mencia. We were just talking about what happened in Russia, and apparently they said that sometimes that they are able to hear. I'm just saying we're gonna have him call in. Is that what we've decided to do?
He's on the line, Dr. Marrero.
Yeah, so we see everybody has to hear. That's the problem. We have to have different.
Different setting, but that's why we got Richard here.
Okay, well, we're going to talk about pain, and that's the most important thing. And I was asking Dr. Mencia before we even got off into this daylight savings, because that probably causes pain in people too. So maybe we don't have to do it unless you want to do it, really. Pain? Okay. We're talking about pain. And, pain is a strange thing. And Ina and I were talking about daylight savings, and so if somebody gets up early in the morning and they're not feeling good, I'll bet that they start to have pain, even though they don't really have pain.
But because they're depressed, and then they just
feel every little thing, right?
That's a good point. Let me tell you about. I usually, when I'm talking about depression, before we introduce our guest, when we talk about depression, I describe it, Anita, as the opposite of being under anesthesia. When you are under anesthesia, you are sedated, you feel nothing. So if you take the spectrum of perception of pain, when you are depressed, if you have a pain that we call, let's say, from 0 to 10, a 2, a depressed patient might describe it as an 8. And it's a real 8. It's not fake. It's a real 8. But and that's why I love working with my next guest, Dr. Gabriel Marrero, who is a pain management doctor, because I can treat the depression portion where Dr. Marrero is managing the pain portion. Good morning, Dr. Marrero.
Good morning. Thank you for having me on the radio.
Oh, our pleasure. Always a pleasure to have you over.
Thank you.
And so, do you get depressed because you're dealing in pain all the time? I mean, I was wondering about doctors. If everyone comes in and they're in pain, how does the doctor not get depressed?
Yeah, that's true. You have a good point. It can be overwhelming because you're seeing patients complaining of pain every day, and the whole day. But at the same time, you can when you can help them and you can change their life, it's very rewarding. But yes, as Dr. Mencia was saying, there is a component of depression, and the reason is because most of the time pain interfere with your daily activities. And sometimes a lady used to play bingo and sit for long hours, and now she cannot sit, and now she cannot play bingo, and she cannot participate with her friends. So, that affects the patient emotionally and affects their mood, and they can get depressed.
So they pop in the Aleve.
They what?
Aleve.
That's what they do. They start taking
Aleves and over-the-counter medications. And that's, like Dr. Marrero said, if you have chronic pain, it can get you depressed. A high percentage of patients that have chronic pain will become depressed. So you have to manage the entire individual. And that's what we do as a team, Dr. Marrero and I, when I'm managing the medical portion. And even if I have the patient well controlled with pain medication, and suddenly they start cleaning the garage or, cleaning the garden, and they might develop a exacerbation of pain, maybe just in the lower back or how do you manage those patients then, Dr. Marrero?
Yeah, sometimes patients, they can have flare-ups of her chronic pain. And as Dr. Mencia said, they were doing some chores in the house, and that kind of caused like an acute on chronic pain. So the way we manage the pain is dependent. If we are talking, for example, this is a patient with spinal stenosis that cause nerve pain in the lower back, like sciatica, where people usually use the term sciatica. So we can give some strong anti-inflammatory medication like steroids for a short period of time. Or depending if it's just more a lumbar strain, we work with some anti-inflammatory medication such as naproxen or Motrin, and we add some anti-inflammatory some muscle relaxant too. So it depends. That is why it's also important to see the patient, to know the patient, to hear the patient, okay? Because the patient has, when you see the patient and you talk to the patient, they have 90% of the time they have the answer of what's going on. So it's important to listen to the patient. But yeah, we manage the acute exacerbation, and then most of them they do very well. Others they keep having significant pain, and those are the ones that we decide to do a procedure to speed up the recovery.
As a grandmaster in Taekwondo, Dr. Marrero, I'm always pushing for exercise. I would like to see my patient active, exercise. And in your field, it becomes a challenge because these are people that say, but I'm in pain, I cannot exercise. How soon and how do you reintroduce activity on these individuals so that they don't become sedentary for the rest of their life?
That's a very, very important point. As I tell my patients, body in motion, stay in motion. So studies, maybe 10 years ago, they came with studies, especially for acute low back pain. They used to say, you have acute low back pain, stay in bed. No. Now the recommendations is that, as soon as you tolerate, it's going to be as tolerated. You try to move around, stand up, walk, okay, because that helps to speed up, especially this acute pain. But in general, when we are talking about, chronic pain, patients that, have pain every day, and they don't want to do exercise, they don't want to do because they are, number one, afraid, or number two is very difficult for them. So the first part, the first part is, number one, do a diagnosis. Then from there we can treat the patient, and then I always want to incorporate some sort of exercise physical therapy, because you can, with the exercise, you can strengthen the muscle, and the muscle helps to support the spine, for example, for low back pain, so that the patients don't rely only on the joints and disc to support the back. Joints, for example, hip. There is a study that showed that if you don't have good range of motion of the hip, that can speed up the arthritis. So that is why it's important for them to do some exercises that stretch the joint. So I think pain is a multidisciplinary approach. So I think it's very essential, very essential. I know that sometimes patients, it's a teamwork. So patients, they have to understand that they have to, work together with the doctor to get better.
Dr. Mencia, wait, before I have a question. When you talked about, you said something about pain here. You talked about pain, and when someone comes in and you say, how is the pain on a scale of 1 to 10? I mean, how does somebody know what 1 to 10 is as far as,
No,
it
we
could
have
be a
to,
3 or 4.
we have to describe to them what do we mean by that. So we say 1 could be like when you have a little joint ache, if this person is, of middle age or more. And 10 will call the worst pain you have ever felt. Some women will say, giving birth. That's a 10 to me. So the worst pain you ever had, they call that a 10. If it only been a toothache, that's probably a low-level pain, where giving birth will be a high-level pain. Having a fracture of a bone will be a 10 type of pain. So then they will correlate with something in their life, and then they go and say, well, it's not when I broke my leg, it's not that kind of pain, and it's not with my joint. So then they go in the middle, and they say, it's not, maybe a 2 or 3, so it's a mild pain. Or maybe it's not when I broke that leg, but it's very close to that. So
I see. Okay, because I wondered if somebody, maybe Ina, her pain would be maybe different than my pain, even though it's the same problem we're having, right?
Right.
And I also had another question. I am very dedicated to having massage, and I do it every 2 weeks. And if I didn't have massage, I think I would get into pain, my neck, from sitting at the computer. Do you not, Dr. Marrero, think that having massage is a very important thing for your patients?
Well, again, and going back very quickly to the point of grading the pain from 1 to 10, everybody's different. And sometimes, like a 10 for one patient is a 7 for another patient. So that is what is important. The important part is when you see the patient on the follow-up, then you see how, okay, now how is the pain? So you can tell if the patient is getting better or not. But yeah, sometimes it's so difficult to tell, how, from 1 to 10, but it helps. It helps to grade the pain. So, so going back to
Massage.
massage.
Let's
the
talk
ma-
about,
the
do you
massage.
want your patients to have massages?
So when it's more issues with the muscles, okay, muscle pain, because it could be different sources of pain. But when it's more muscle pain, the massage helps with the circulation of the muscle, okay, and with the spasm. And in some patients, it works very, very good. So and also good hydration too, especially after the massage.
Right.
Why is that? She always says to me, go have some water. I'm not thirsty. Why does she want?
Because
No,
you're
it's because-
mobilizing all the muscle enzymes. They are moving, and they're going to be clear. Those enzymes that you move around, they're going to be cleared through the kidneys. So you want to drink fluid, so that as you're moving those muscles, massaging those muscles, you release some of those muscle enzymes into the circulation. So you want to hydrate yourself, so that everything get cleared up.
Okay, so can we talk about prevention, Dr. Marrero? How can we prevent having the pain that you
Hurting ourselves.
Yeah,
How
right.
can we prevent hurting
right?
ourselves?
Yeah, let's go there.
Yes. So, and that is why we were talking about exercises. That is, I think, the main preventive. Not preventive because, unfortunately, there's going to be always a genetic component, meaning that, for example, patients, they get wrinkles. I tell the patient they get wrinkles in the face, right? Some patients, they get more wrinkles than others. We don't control that. So in the spine, in the joints, we get wrinkles too. I call it arthritis. So some patients, they develop arthritis faster than other patients. But as I was telling before, the fact that we can help assist the spine, the joint, the disc, by strengthening the muscle in the back, or, for example, the hip, strengthening the muscle of the pelvis, and also keeping good range of motion of the hip. Because remember, if you have limited range of motion of the hip, then the weight bearing is relying on a smaller area of your joint. By increasing the range of motion of your hip, you have more area to rely for the weight to spread over the whole joint. So, extremely important exercises.
And as a Taekwondo grandmaster, I always tell my patients and my staff, they watch me teach them in the exam room some exercises for the hips, some exercises for the back, exercises for the shoulders. And what is important is, like Dr. Marrero just said, if the pain is coming from the joint, even on the spine or on your knee or on your hip or on your shoulder, when you get pain on a joint is when bone is touching bone. That means you are not lubricated. You don't have enough lubrication there. And patients tend to get out of bed or out of the couch and just try to walk as they move on. And when they are walking, if they need to take an additional step, that joint is not going to respond because it's frozen. It's a frozen joint. So what I tell my patient, that one of the first things they should do when we get up in the morning, the first thing we should do with ourselves is to lubricate our joints. So we do lubrication by, let's say, bending forward, dangling your right arm, and just do circular motion for the shoulder. Do it for the elbow, do it for the wrist, and then do the same thing for the ankle, for the knee, for your hip, and then do it for the back by moving side to side and bending forward again, bending back. And by doing just bending movement without overdoing it, just moving the joints throughout your entire body, by just moving those joints, a few minutes, that's all it takes for the joint to re-lubricate itself. And when we do that, sometimes you see a person going to a restaurant and they misstep. And they had to take that extra step so that they don't fall. Well, if the joint is frozen, your mind is saying, take that extra step. The hip is saying, I'm going nowhere. I'm frozen here. Uh-huh. And those are the people that end up falling. If you see a young kid miss a step, they are able to do a ballerina split and take that extra step, and they keep walking and they are up and about. So lubricating the joint is a good preventive move that we can do with our life so that we can prevent hurting ourselves and ending up with chronic pain. Then once, things will happen to all of us. Sometimes even myself, if I exercise, sometimes I will be sitting too much in the computer or doing something, I might get a little lower back pain. If that lower back pain go away when you take a hot bath or something like that, or you exercise a little bit and it goes away, you are fine. But if it's persistent, then you need to come and see Dr. Marrero. Why? Because right now it's an acute problem that we have. An acute means that it just happened recently and it's still manageable. But when you let it go for months upon months, then it becomes a chronic problem. And Dr. Marrero can elaborate on the management of those two conditions, an acute pain versus a chronic pain, and the prognosis, Dr. Marrero.
Okay, just before you do that, I have to give some phone numbers.
Yeah, if they're going to call him, we have to give a number.
So, well, that's very important. First, let's give the number for AGI Medical and Dental Centers. If you're going to go, especially Saturday, Dr. Mencia's got one foot out the door already to run down to down to Fort Lauderdale, and the phone number there is 954-489-1345. And I know that they're open in Boynton Beach today too, because I was there yesterday where they had this. In fact, we have to do that too. We have to really mention about the open house, but before we do it, let me give you a phone number if you want to call them at Boynton Beach. It's 561-270-6494. And I want to, just before you say anything, Dr. Marrero, I want to talk about something fantastic that they're doing. In fact, Dr. Mencia, why don't you do that? Because that's going to happen Friday now at your place.
Right. We did one yesterday, March 24th, at the Boynton Beach, and it was an open house on the latest dental implant options. And it went very well with Dr. Sakis and Dr. Rosemary and the representative Benjamin from the implant company. He was there. So it went very well. So we are going to, I think the one in Fort Lauderdale is going to be even bigger. So we're going to be having on March 31st, that's next Friday, starting at 3 o'clock, 1608 East Commercial Boulevard at the main office over there in Fort Lauderdale. We are going to have another open house for implant options. We're going to have there some wine will be served for the guests there and the staff, I guess.
But it's an educational seminar,
It's
isn't
an
it?
educational seminar to talk about at any age, when should I get an implant, how do I qualify, how expensive it is. And it was very interesting. One of our listeners from the radio, he went to the event, and he was talking about that he had implants done 20 years ago. And
Really?
his experience and the cost and all of that. So Dr. Saki said, well, imagine trying to buy a cell phone 15 years ago and buying a cell phone today. The price have changed so much.
And the technique.
And all of that. So it's much, much safer now to when you do an implant. And the outcome is outstanding. You can even have your denture put in with clipper on, so that you don't have to use the glue and this thing to hold your denture in. So that's going to be next Friday, March 31st. And if you want to come, please RSVP at 954-489-2517 and let them know that you want to come to the open house for implant.
Okay, and now I know people want to know how to get in touch with Dr. Marrero. You can always call AGI. They'll help you with that. But let me give you his direct number. It's 954-678-9531. You can make an appointment there. Just please tell them that you heard him on Dr. Mencia's show. And also, they have a website, which is FLAHRS.com. Remember, this is Pencil Talk Radio. Get your pencils out. Phone number is 954-678-9531. So, Dr. Marrero, are you in any pain yourself now? What happens to a doctor like you when you get in pain?
They come and see me.
No, actually, I have issues with my hip, and that's good because I also can experience it myself. So several years ago, I had a labor and tear, and I didn't take care of it right away. So I waited. So I developed a little bit of. They had to and they did surgery, laparoscopic surgery. They removed part of it because it's what calcified was locking my hip, and I developed a little bit of arthritis. So what I have been doing is again the exercise, and also I do at least one a year PRP, platelet-rich plasma. And I think this is a topic that, we should, have a radio show at some point about PRP, stem cells, because it's the future. And so I do my exercises, and so far, so good. So far, so good.
I'm glad you brought that up. I think Dr. Mencia definitely should be doing that, and you could do that at your new spa.
At the spa, we can do PRP, yes.
Absolutely.
Yeah.
So that's really wonderful you brought that up, Dr. Marrero. That is the newest thing.
Yeah.
That's
why I love working with him, because he's a cutting edge. They do the kyphoplastia at the office, so we do the procedure at the other office where he has all the equipment, and but he can do the consultation at either office, and then he'll decide if it's something he can treat immediately when you are there, or does he need to take you to the other office where he has all the equipment to make it make it a safe treatment for the patient.
Well, and also because you need a diagnosis. 'Cause
We
you're
need
such
exactly to make sure that we have the right level. And, it's interesting. Not too long ago, Dr. Marrero, we treated a patient with a fracture of the back and got the kyphoplastia done in the at your office.
Yeah, well, I was thinking about, as you were talking about keeping your joints lubricated, should I be drinking olive oil?
Olive oil is healthy for you. It's healthy for you. It's good.
You don't want to drink it, right? You just want to put it on your food.
On your food,
Just put it on your salad.
Yeah.
That's true. Put it on your salad.
I had some lentil soup with a little olive oil yesterday, so I drank a spoon or two.
Yeah, that's terrific. Well, Dr. Marrero, it's wonderful that you were able to talk to us this morning about this, because I see that you have a lot of things that you do, and with Dr. Mencia's help, I think that it really works. See, that's what I like about Dr. Mencia. He has such a cadre of people you work with, and
I've been blessed. I've been surrounded by, people like Dr. Marrero, excellent bedside manner. Sometimes we are delighted to have it on a Saturday for those patients that cannot come on the weekdays. Patient can call either office. He's with us every Monday, sometime on Saturday when he has the time. But you'll be amazed with his bedside manner.
great. Well,
Thank
Dr. Mencia is very particular. You know that he doesn't bring people in if they don't like to give hugs, or if they don't like to listen. No, it's important. That's right. All your people. I mean, Dr. Rosemary was hugging a lot of people, everything. It really makes a difference. And thank you, Dr. Marrero, for being a part of this morning. And I look forward to maybe doing another show with the PRP.
That's a good show. We're going to do it soon.
Okay.
Thank you for having me. Thank you so much.
Okay, Dr. Mencia,
Thanks
that's
for
it.
listening to The Wonderful
Excellent.
World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.